The drive for me is making a difference. To see that, before veterans psychology, there was no organisation like what we are providing, and now there is. And so veterans have a choice in terms of where they can access their mental health care. Hi, my name's Nadia Teong. I'm a clinical psychologist and the founder of Veterans Psychology, which is a psychology practice focused on supporting veterans and the people who support them. Before I studied at Deakin, I was a primary school teacher. And throughout my time as a teacher, I realised that I really enjoyed working with the students who had behavioural challenges or learning difficulties. So that was what inspired me to go on and do the graduate diploma of psychological studies through Deakin. I decided to do an internship through the Australian Army. So I joined for what I thought was going to be 3 years, and I ended up staying for 11. Throughout my time in my first 2 years in the military, I got 3 deployments overseas as a psychologist with the troops, which gave me a really good personal insight into the challenges that they face. After 11 years in the Army and 2 kids later, I decided that it was time for me to hang up my boots, and I really wanted to go into private practice. And I knew a lot of my colleagues from Army had done the same. They'd gone into private practice, but there was no one way to find these psychologists who also had lived experience of military life. That was the reason that I started Veterans Psychology, was just as a one-stop place where the veterans could know that they would find psychologists that would have, a personal insight and understanding into the veteran experience. We know from the research that the riskiest time in a veteran's career is when they're leaving the military and the years after that. There was so much opportunity there to be able to contribute in that really risky time, was one of the reasons that I started Veterans Psychology. Our impact is really growing. We've got psychologists now in Townsville, Brisbane, Sydney, Melbourne and Adelaide. And we offer telehealth services Australia-wide. We've been recognised by the Prime Minister last year in the National Veteran Employment Awards, which is amazing. People agree that this is a good idea. That really is a testament to the work of the whole team at Veterans Psychology, that what we're doing is making an impact for good. I think the key to ongoing improvement is continued listening. We need to continue to engage with veterans to appreciate and understand what they need to improve their own health and wellbeing. I think the problem's not yet solved. We've got lots of scope to continue to improve veteran access to mental health services that are tailored to their needs. And I love being part of the solution to that problem.